20 minutes, we look into the life of Anita Rowe, a high school 17-year-old cheerleader who deals with bulimia nervosa. Anita engages in repeated episodes of binge eating followed by inappropriate behaviors like self-induced vomiting, misuse of laxatives, diuretics, and other medications, and fasting. It is estimated that up to 4% of females in the United States will have bulimia during their lifetime. Of those practicing bulimia, only 6% obtain treatment. 3.9% of these bulimic individuals will die.
Hey Teresa, how are you?
Hi.
How have you been?
All right. How are you doing?
Good. So how's Anita?
She's okay. Yeah.
Anything going on?
She's staying in her room a lot. She seems a little depressed. She's a little weird at dinner time.
Right.
But then I notice she's eating a lot when we're not around.
Yeah. Well, I've been kind of concerned about her. You know, I've noticed some things in school that's got me a little concerned. I didn't know whether I wanted to come to you or not.
Yeah.
Didn't want to make her mad, you know, since we're, you know, in gym class together, and then I see her, you know, at lunch and stuff like that. But yeah, I've been a little concerned. She seems a little distracted sometimes.
Mm-hmm.
I'm also seeing her a lot at the gym. Like on the times that I'm at the gym, like she goes through PE that day, but then later on she's at the gym. Have you been noticing any of that too, or?
I definitely have seen that she's like counting calories that she's eating. I find like little scraps of paper around with like calorie counts on them, which I think what they
Right.
are.
Well, you know, in cheerleading, that seems to be like such a predominance of people watching their weight. You know, they feel like as cheerleaders, they have a certain stigma. The other, you know, classmates and whatever, they want to look a certain way. And then also with some of the things that cheerleaders have to do, you know, doing the pyramids and whatnot, they get really super concerned about their weight. Do you think maybe that might be?
I do. Yeah, I do. I see that she's becoming, you know, really
Right.
uncomfortable around food, and I've actually found laxatives in her room recently.
Oh, that's not a good thing.
Yeah.
And I think that I may have overheard some of the other cheerleaders talking. I wasn't for sure if it was about Anita, but that, you know, they were talking about one girl in particular they were worried about, that she was kind of hiding some things from her mom, or that's what they thought, that she was hiding things. And that maybe they thought she might have a problem. And maybe now that we've talked, maybe putting the pieces together, maybe they're really talking about Anita, and I'm concerned about that.
Yeah, yeah. Well, I'll definitely talk to her. I'm
Okay.
definitely going to talk to her.
Sounds good.
Thank you so
Well, it was
much.
great seeing you, Teresa.
Me too.
Come in.
Hey, honey.
Hi.
How are you doing?
I'm doing good.
I wanted to see if you have a minute to talk.
Sure.
All
About
right,
what?
Good. Well, I came into your room the other night.
You came into my room?
I did, yeah, because I've been concerned. Your gym teacher pulled me to the side
About
today.
what?
About just kind of like your eating habits and what's going on with you around.
Nothing's going on with me.
Are you sure?
Yes.
Did you want to tell me anything about like how you're feeling about yourself?
I don't know. Just don't know how I'm feeling.
Okay. All right. Are you having any trouble with food? Are you eating things that I'm not making?
Well, sometimes I'll go out with Stacy and we'll eat out, but I mean, other than that, nothing really.
And when you're eating out, are you eating like more than you normally would?
Sometimes. It just depends on where we're at.
And what about like laxatives or something like that?
I got into your medicine cabinet and I've been taking laxatives.
Okay. Because I found these in your room because I was looking around because I was worried. And I found a lot of like food wrappers. So, and it looks like maybe you're spending more time in your room.
I don't know, I just haven't been happy lately.
Yeah. And how long have you been taking these?
For a couple months now.
And how does that make you feel about yourself?
Not very good.
Yeah. So, I never talked to you about this before, but when I was a teenager, I struggled with bulimia as well.
You never told me that.
I know. It's not, something that comes up, and I was hoping that just by even not talking to you about it, maybe it wouldn't come to your mind. Maybe it would keep you from, thinking that that was an option. And your aunt, she also.
Shirley.
Yeah. Shirley. She spent some time in like a rehabilitation for anorexia and bulimia. And you might see when we go visit her, she still kind of struggles a little with food.
Do you think I could talk to her about it?
I think that would be a great idea. Yeah. And I think that if we can get you talking to somebody about it, that's going to help you for the rest of your life. Because if this isn't making you feel good, then you need to do something to change that, because you don't want to spend the rest of your life, right? Feeling like this.
Hi Anita, how are you?
I'm doing okay.
I'm Louisa, I'm going to do your assessment today. So what brought you here today?
I've just kind of been having some abdominal pain. I think I've been having some heartburn, and I've been very tired lately. I can barely concentrate, and my throat's really been hurting.
Okay. When did it start? When you noticed?
It's kind of been going on for a while. I'm not sure how long.
Months of
It's
that
been,
week?
it's been a couple months.
Couple months?
Mhm.
Oh, okay. How is your pain from 0 to 10?
I'd say it's about probably a 5.
It's a 5.
Mhm.
Are you taking some medication to relieve the pain, the heartburn?
Not really, but I've kind of been taking like I feel a little constipated, so I've been
Mhm.
taking like some laxatives.
Which type of laxatives are you taking?
Relax.
Okay. Are you taking something else? Other type of medication, herbs?
No, I'm not. I haven't really been taking. I've been drinking like a lot of green tea.
Green tea. When was your last bowel movement?
It was this morning.
Was it this morning? Can you describe?
It was just kind of like a lighter color stool.
Cornerstone. Okay. I am going to check your blood pressure.
Okay.
And it is normal. Do you have any problem with your respiration? You have breathing problems?
Just asthma. for the
Asthma?
most
Okay,
part.
I'm going to listen to your lungs. Take a deep breath. Another one. Another one. One. Okay, that sounds really good. If you can come with me, I can get on the scale. If you can step on the scale. Okay, have you lost weight lately?
A little bit.
Okay, 5'5". Do you have a problem talking about food and eating?
I would say so.
Okay. How often do you eat?
Probably about like 2 or 3 times a day.
How much?
It kind of depends on how I'm feeling at the moment.
What you normally eat? What is your typical meal in a day?
In a day, I might go. So sometimes I'll like go to McDonald's and I'll go get maybe like 2 cheeseburgers. I might get like a side of nuggets and a couple, like a large thing of fries,
Mhm.
and I might eat that, but then it's like the next meal I probably wouldn't hardly have anything.
Okay, do you eat in between meals?
No.
Do you eat after dinner? During the
Um,
night?
Sometimes I will go and I'll have, you know, maybe like if somebody, like my mom make a pie, I might eat a quarter of
You
the pie.
spend a lot of time in the bathroom?
I would say so.
Okay, I'm going to ask you some specific question. Let me know if you feel uncomfortable.
Okay.
Do you make yourself vomit because you feel uncomfortable?
Yes.
Yeah, okay. Do you worry that you have lost control over how much you eat?
Yeah, I would say so.
Do you recently lost 15 pounds or more in 3 months period?
Yes.
Do you believe yourself to be fat when others say you are too thin?
Yes.
Would you say that food dominates your life?
I would really say so.
Big R? So you said you have sore throat.
Uh-huh.
When was the last time you went to the dentist?
It's been about a year.
8 years, because I see you have some cavity and your throat is really red. Okay.
The clinical picture of bulimia nervosa, you'll notice some dental erosions, edema, you'll have electrolyte imbalance, extreme weakness, GERD, hypertension, usually normal or overweight, sore throat, and Russell. So Teresa, when did you first discover that Anita had this going on?
Probably freshman year of high school, I started to notice that she was wearing baggier clothes. She seemed to be like a little uncomfortable around dinner time, really specific about what she would eat and kind of how much she was eating.
So as Anita's gym teacher, you were the first one who noticed. What alerted you? What made you let Teresa know what was going on?
Well, about her freshman year, I noticed some different things in PE class. I noticed that she was excessively exercising, and then that evening when I was in the gym, I saw her in the gym for hours. She would be there before I showed up, she would be there after I left, and she was always there. And also when I would go to the lunchroom and I would see all the cheerleader groups, then it seemed like she wasn't quite eating as much as all the other girls were, but she also seemed like she was maybe hiding some things or just kind of uncomfortable about things. So I felt like after a little while of me seeing that more and more that I wanted to go and talk to Teresa and just tell her my concerns.
Great.
How has this affected the family?
Well, we have noticed that she's spending more time by herself, kind of closing herself in her room more. And so, you know, that affects our family time together. She seems to be feeling insecure about her body. So when we all go to the beach together, you know, she's wearing big shirts and, you know, afraid to see her friends out at the beach. We've noticed that she'll maybe pick at her dinner and seem uncomfortable about eating dinner, but then in the morning when I look in the refrigerator, there's a lot of food that's gone. I've found laxatives in her bedroom, kind of hidden away, and when I've emptied her trash, I've found, you know, large quantities of food wrappers and fast food bags that I'm not buying for her.
So how do you plan on moving on from this?
Well, we've started counseling. Anita's going to counseling by herself, and then we're doing family counseling as well. We are taking her to OA meetings, Overeaters Anonymous meetings. She's gotten herself a sponsor, and that's been helpful, I think, in her having somebody to talk to who knows what's going on and understands. She's got goals set for how she's going to get better.
So when did you start to feel uncomfortable with your body?
I think I first started feeling uncomfortable like in middle school, and then it just kind of escalated once I got into high school and I started cheerleading.
What do you think triggered the binging and purging?
I think starting cheerleading and going to a new school and being anxious before games, I definitely think that was part of it, and I wanted to fit the mold of a cheerleader.
Yeah. How do you think the binging and purging made you feel, or makes you feel?
When I'm actually doing it, it feels very good. It's like a food high, but afterwards I feel horrible, and that's what makes me purge.
How have the group therapy sessions helped you?
It's kind of like dulled my negative self-talk, and I feel better about it.
What have you learned about yourself through all of this?
That I'm a very resilient person, and that I can get through this.
Good. Well, I'm glad. Do you think that bulimia affects the whole family?
Yes, to a certain extent, I really think it does, because the child is hiding, that side of them, and then when it comes out, the parents, I guess, are kind of left in shock as to where they thought they knew that person, but now they know like a whole different side of them that they never knew. So I think the parents kind of feel a little bit ashamed or disappointed themselves for not seeing it sooner and catching it. So yeah, I really do think it really affects the whole family.
Are there treatments available for the whole family?
Yes, there is group therapy available. It's a really good option because it helps the kids to open up as well as the parents, and teaches the parents, therapeutic communication with them and how to talk to their child and how to accept what has happened to their family. But it keeps it in a structured environment to where it's controlled, but yet they can express their emotions in a very healthy way.
What is the likelihood for relapse?
That is hard to say. It really depends on, the underlying things, the comorbidities of the disease. Because a lot of times patients that are dealing with bulimia are also dealing with other psychiatric illnesses, such as like depression or body dysmorphic disorder, and so you have to address that underlying condition before you can address the bulimia. And sometimes that plays into relapse.
Well, what are some things that you consider when taking care of a patient with an eating disorder?
Well, there's a lot of things that have to go into it. You have to realize, that the way they see themselves is not going to be the same way that you see them. And you can't just walk in and be like, oh, you look so beautiful today, because they're going to see that as just a superficial comment. You have to really go deeper and, use positive reinforcement when they do something good. At mealtime, we really have to stress, eating as much as they can. We can't force them to eat the whole plate, but, we sit there and monitor them. We have a sitter that'll sit and watch them eat, and then they have to stand there for an hour after they're done eating to make sure they don't purge. We also will weigh them daily, and we have to check the bed or anything they're wearing to make sure they don't have extra weight added, so they're not hiding up the fact they're still purging in order to lose weight. Mainly watching them.
All right. Well, thank you for answering my questions.
Hi, my name is Brianna, and I play Anita Rowe in this film. Between 1.1% and 4.6% of females and 0.1% to 0.5% of males will develop bulimia. After binging, people with bulimia need to purge. If your loved one shows signs of bulimia nervosa, talk to him or her about it. These hotlines are there to help.